Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the opportunity to sit down with Megan Carlson, who serves as the Vice President for Pair Team. Now, many of you may have heard Pair Team, and even if you haven't, they have a really cool story about how they take existing organizations and their connections in their community and really pair up and provide some clinical expertise to ultimately become an enhanced care management organization. Megan shares a little bit about her background and shows why she's a great fit to help lead Pair Team in its development here in California as a partner in enhanced care management and as they expand to other states as well. We hope you enjoyed today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, checking us out on our YouTube channel, or listening to us wherever you listen to your podcasts. Thanks, everybody. Enjoy today's episode. Megan, thanks so much for joining the show today.
Thank you for having me.
Absolutely. So I'm excited to learn more about what you guys are doing at Pair Team. But before we jump into that, Megan, we like to get to know the guest a little bit. So maybe if you can kick us off with like a fun fact, hobby, something like that.
Yeah, no problem. In thinking about this question, I was really trying to evaluate what hobbies I do have. And I kind of like squarely landed on the one that I have time for right now, which is gardening. Okay. I really enjoy being able to go into my backyard and like pulling whatever produce I need. And I will say I've started very limited. I'm just working with tomatoes right now, which I think is a great entry point into gardening because they are very bountiful and they almost produce too much. But very, very difficult to mess up, at least right now. So I have been really enjoying that. But I definitely am a novice and I'm excited to continue to grow other types of vegetables or fruit.
That is awesome. I'm guessing I'm quite a bit older than you. And as I get older, I noticed it seems like gardening for me, at least in my circles, has been more of like as we age. You're a young lady. I'm curious of the inspiration. Like what has inspired you to get into gardening?
I think it's I love what I do. I have also like a young family of two small boys, and so it's what do I have time for right now? Yeah. And the nice thing about gardening is it is very much like a leisure. I check on it in the morning. It's something I can do with the kids, and then it also like produces like it's very rewarding because you get to go out and pick what you grow, etc. And so it's not only about myself and what I have time to grow and to devote time towards, but it's also for my children to be able to like see a product of their efforts. So. But it is very peaceful and I have a bird feeder. I mean, you're right. I've really taken a right turn right into fast forward 10 or 15 years, but I love it.
That is awesome. I have a friend who actually edits this podcast.
Yeah.
Quick shout. I know we're here to focus on you, but quick shout out to Cameron, busy gardener.
Yeah.
He would love to hear what you're talking about.
I will take all of the tips and tricks. I know there's apps out there that can help me identify what's going on with my plant. I have not yet started to download those, but once I do, then I'll really be in it. And so I'm excited for that.
Awesome. Really quickly with the tomatoes. I'm a big salsa guy and hot sauce guy. Have you tried any of that yet or not?
1,000%. As you know, with tomatoes, you just have so many of them. So tomato soup. I mean, especially this summer, I was also growing basil. And so to be able to have like bruschetta, that was wonderful. So it's really been very rewarding, but you're right. Now I'm getting into like, okay, now I need to start freezing things. And that's when I'm going to start making some salsa.
All right. Well, look forward to hopefully staying in touch and maybe even dabbling in some of that.
Absolutely.
And to ask for a quick shipment over your salsa.
I know. I need to.
Anyway, so moving on to your work into eventually getting into Pair Team and some of the work you're doing here in California. Tell us about your upbringing, where you went to college, and ultimately what was the inspiration to do some of the work you're doing today? And then we'll jump into Pair Team.
Sure. So born and raised in North Carolina. And as you said a little bit earlier, I've been able to mask the Southern accent a bit. It'll come out when I say certain words. But just really had a very clear understanding from an early age what I wanted to do with my life. My mom was an EMT. My stepdad was a firefighter. My dad has been working in our local hospital for majority of my life. And so I very clearly learned, what do I want to do? I want to help people in some form or fashion, right? And initially, I thought that might be going into education and into teaching. But in my undergrad at NC State, I was able to major in biology and then go on to get my master's in public health. And so it became very clear to me that I wanted to take this knowledge and be able to initially, coming out of my graduate career, educate others. And so that really started with operating a senior center for Humana. And so talk about a population that I absolutely love working with, older adults. They really just lit this fire within me. Not only did they teach me obviously so much life lessons, also how to do really hard Sudoku puzzles.
Yes.
But they also, it was such a launching point for me because especially, and this was, upwards of 10 years ago, but especially being able to witness kind of firsthand how these seniors were struggling with realizing that, they didn't have enough income to be able to pay their bills. They were running out of money pretty quickly. And that was counterintuitive to what they thought would happen in terms of retirement. And so they were often coming to me saying, Megan, I need to go find a job. How do I do that? Or Megan, I'm needing help with finding some food because I'm, running out of money for the month. What resources do we have? And so that really was the launching pad for what became kind of this evolution of my career, which on the surface seems disconnected, but now as I zoom out and as I've been able to kind of voice over this journey out loud a few times, it really is all coming back to this through line of giving back to others. And so from working with Humana, I then started working with our local hospital, part of the UNC cancer system, and I supported cancer patients with a pilot funded by the Duke Endowment. And it really was to be able to establish a lay navigation program utilizing the volunteer populations at a few different Carolina sites across the state to be able to train their volunteers as lay patient navigators, helping cancer patients navigate resources in what is the most stressful, crucial time of their life, and in a situation where they're not thinking about, oh, how do I, get back from my radiology appointments when I live 45 minutes to an hour away? How am I able to put food on the table when I'm exhausted from my treatments? And so standing up that program was not only very personally rewarding for me, but also just really cemented the mission and the passion that I have. And so from there, from UNC, I went and had a really long career, long for health tech, at Unitas, which was really to build coordinated care networks to address social, emotional, physical needs of communities. And so that was something that I was able to do, not only building the first statewide coordinated network in North Carolina, but then Unitas, in the 2020, 2021 boom, really outside of the pandemic, was able to build networks across the country. And so I really found that work extremely rewarding. Also, it was this nice intersection of product and tech and partnerships and how they really can become a symbiotic relationship to one another and they don't have to act in tension with each other. And so did that for almost 6 years and then found my way to Pair Team. And so Pair Team has really been an opportunity for me to build 0 to 1 again. I have a huge passion for creating these types of systems and processes internally and externally. So I've been able to design the strategy for what would become our community care hub. And so now, having grown that to over 100 organizations, I've probably, I think, 3x'd it in my time here so far. This community care hub, we call it the Pair Impact Network, but really functions as a social care extension of the services that we're able to provide to our at-risk populations. And so at the core of what I know to be true, and this is kind of like summing it up with a bow, is that we know that 80% of someone's health is determined by their social needs. And each and every one of the organizations and companies that I've worked for has really taken that very seriously and started to address and solve that problem. So that's been really the through line so far.
That is really cool. So I've known of Pair Team, for a couple years. I know Pair Team itself is relatively a newer organization.
Mm-hmm. Yeah.
And so sometimes when I see these newer organizations have a leader like yourself come in, like there's no connection. It's like, yeah, they know how to grow something, but there's no like healthcare connection or, they kind of like talk about how they're connected to the mission of the organization, but it's a little bit of a stretch. Not with you, right? Like this is really cool because your story about using lay people, even volunteers, to help in the navigation of a patient's journey, right? And then talking about how you helped build Unitas, which I'm sure many of our listeners are familiar with. Like, this is really a fit for you.
Yeah.
I can see, why Pair Team wanted you on their team, which is really cool. I remember a couple years ago at a conference, Pair Team was brand new. I'm like, oh, it'll be interesting to see, how this company does. And so it's cool to see, like, yeah, you guys have some legs. And here in California now is our focus of today's show, which is, I know it is where Pair Team mostly is. You mentioned, you just started something in Nevada as well, but we'll focus on California today.
Yeah.
So tell us about this community care hub, forgive me if I'm saying this incorrectly, Pair Impact Network. Tell me about those and what those mean.
Yeah. So the community care hub is a concept that was very familiar with me before coming to Pair Team, but just wasn't kind of functioned as that. And it's something I think when you think about what communities have been doing for decades, to be able to kind of rally around what the common needs are in their community and to form collaborations, consortiums to be able to address these needs. This is something that has been existing. And so the real benefit of the community care hub and specifically the Pair Impact Network is we're leveraging the knowledge that these communities have, the trust that they have with the individuals that they serve. And we're using that as almost the foundational layer for Pair Team, starting there. And then also from Pair Team being, a virtual medical provider, bringing in our clinical expertise as an addition to the social care services that are already being provided in these communities. And I think what's really important to me and something that's part of the process when I go into new states, counties, et cetera, is to be able to conduct an original, I call it a landscape analysis, but it's foundational because it allows you to understand what work has this community already been doing, right? We're not coming in and reinventing the wheel. These communities have experts and leaders that already know how to do a lot of this work, how to serve their communities, and perhaps they just need a bit more leverage to be able to provide higher level care to the individuals that they're serving. And so Pair Team not only is coming in as a clinical partner, but in a lot of our programs, we're coming in as a funder as well. And I'm sure that this is not news to you, but the nonprofit space, in the past year and a half, 2 years, it's been really difficult for them in terms of being able to secure funding with the regulatory environment that we have right now. And so Pair Team, something that I've always had a passion for, and as 1115 waivers have come out over the last few years, we're actually starting to be able to see not only do we have a very clear idea of how to reimburse for physical needs, medical needs, but now we're starting to see these avenues for reimbursing for social care needs. And so that's also been a really clear benefit of participating in our Pair Impact Network, is that these organizations are also able to have funding coming in, which now more than ever is letting them keep their doors open, keep their staff, and serve more people. So that's been really crucial and a personal mission for me, for sure.
Awesome. You're clearly a smart person. I don't have quite the IQ you probably have. So I'm going to ask a favor. And if you can kind of maybe, in layman's terms, give an example. Let's say an audience member is a new grad out of college and they're just entering the social services world. And like Pair Team, work with these not-for-profits, help fund, they're helping clinical expertise. These all sound great, but what does that actually mean, right? Yeah. So like a layperson or someone just entering the healthcare world, what do you guys do?
Yeah, so I'll start it from, I always like to bring myself to like a patient or a client point of view, right? Okay. So I'm a single mom. I have 2 kids to support, and I don't have a job right now, and I'm couch surfing as a result of that, right? So my primary need is to be able to right now feed my family and make sure that they have a safe place to stay. And so I am probably working or going to local organizations in my community that can help solve some of those needs. The first and most obvious avenue would be that I'm going to go to my local food pantry, because I heard that each week you can get a food box to feed your family. Yeah. And so that's a priority for me. And so that's where I'm going to go. And probably when I'm at that food pantry, because individuals that work in nonprofits are never just concerned about the only thing they can provide. They're often navigating for other needs. Yeah. They're going to tell me about another organization down the street that has an emergency shelter for families. And so I'm interested in how am I eligible for that? What can I do? And then while I'm at that food pantry, they say, we also work with this other organization called Pair Team. They run this program called Enhanced Care Management, which means little to nothing to me as I have other priorities as a single mom. But what I hear out of that conversation is, and they can provide you with more support, right? We provide you food boxes, but Pair Team is going to be this connector to other organizations that can serve other needs. Perhaps you haven't been, me as a single mom, I haven't been to my primary care provider in a few years. So that's important, right? Or perhaps my children aren't in school right now because they don't have the vaccinations that they need, or perhaps I don't have the transportation to get them to schools, right? So they're not getting that need met. This organization can help me with that, right? So just Pair Team becomes this connector, this navigator that not only is going to provide the clinical care that I need in-house, right? Because we have our own RNs, nurse practitioners, et cetera, but it's also going to route me to organizations that are local to me in my community that are easy to get to so that I can ensure that I have what I need for myself and for my family. And that's the paradigm that we're looking to create here.
Okay, got it. So are you guys like quote unquote pairing up with existing not-for-profits, community-based organizations and helping to run the ECM with your own staff? Are you just providing guidance and supervision and the local group provides the staff? How does that work?
So yeah, Pear Team is a fully virtual clinical health provider that's also not only, like I said, do we have the RNs and NPs in-house to provide bridge care, right? We always want to connect a client in the community or patient back to their primary care provider, but in some instances that's just not possible, and they do need support, whether it is with managing chronic conditions, getting certain medications. So we provide that bridge support, but then internally we also have our care team is the largest part of Pear Team. And so we also have our LCMs, and these LCMs are care managers. Each and every patient, client, you'll hear me use those words interchangeably because a person in the community is a client, a resident, et cetera. And then when they're enrolled into our programs, they become a patient. So defining that verbiage a bit. But when someone is enrolled with us, they get their own LCM. And so this individual is their an assistant's the wrong word, but it really is their partner to provide them with whatever needs that they have. They conduct an initial screening assessment with these individuals to figure out, do they have social needs around food, around housing, around transportation? Do they have clinical needs that we can provide bridge care, but also connect them back with a local dentist or a local psychiatrist, right? And so Pear Team really does take all of that on. And our goal is to really become that partner that is allowing an individual to proceed down the road of self-sufficiency, of being able to be autonomous, of being able to go from couch surfing to having permanent housing, right? And so that means that we're staying with our patients for a while. And that's the intention, right? The intention is to whatever needs that they have, we want to help you set those goals, and we're going to help you meet those goals. And eventually over time, while initially we may be scheduling those appointments for you, following up with you, making sure you got where you needed to go, the goal is to equip an individual with the resources and the freedom to be able to schedule their own appointments, to make sure that they get there on time, right? And so Pear Team really is just with each and every one of our patients along the entire journey. And that includes ensuring that they're leveraging local community-based organizations to them as well.
Got it. So if I run a local not-for-profit and I hear about ECM, I'm like, I'm too busy.
Yeah.
Worry about ECM because I got to do all this other stuff. Yes, if I had lots of staff and plenty of time, I could build my own ECM. And if I had plenty of money, I could build my own ECM. I'm just kind of thinking about everything you've said. So Pear Team, in a sense, can tell the local not-for-profit, hey, great idea, or we have this idea. Whoever comes to each other first, doesn't matter. We can help build this for you.
Yeah.
Right? You have the patients, you have the members, they need these services. Let us help you help them.
Yeah, exactly.
And you kind of build it and run it for them.
Yeah, exactly. And then what we're able to do is that we consider these partners a social care arm as a part of our care team, right? Okay. And so we want to make sure that the services that they're providing, whether it is food boxes or navigation services or diapers or clothing, we also, and part of our mission is that we have devised a program. It's called our ECM Pathways program, but we also kick a portion of that revenue back to the community-based organization for the services that they're providing to our shared patients. And so it's a way for them to not only get their clients enrolled into this higher touch, higher level of care program, but then also to be reimbursed for the services that they've been providing. And so when I talk about being able to truly drive revenue back into the communities, this is what I'm really referring to. And that's the closed loop system we've been able to create.
That's great. And that you can talk openly. I know when it comes to like money, it's a very sensitive subject, right? Yeah. Especially when it comes to federal or state funds. So for you to be able to talk openly about how that helps benefit the community, it's clear that I'm assuming it's been vetted because you guys are partnered with a lot of managed Medi-Cal organizations throughout the state. So that's really cool. And I try to avoid the money talk in podcasts, but I know a lot of our listeners are eager to hear how that works. So that's cool that you guys, again, I know I said it 30 seconds ago, that you guys have a program that helps send some of this revenue back into the community and ultimately benefit the local CBO, the members, or clients, patients, but also health plans listening, members, of course, right?
And it's crucial. And I think, the Pathways program was something that we started in January. I consider it, although I have two children, I consider this my third baby. And it really was an offshoot of the enhanced care management program, which we've been operating for some time now. But this was my version of, okay, great. I want nonprofits, other partners to be a part of this ecosystem. How can I ensure that they have an equal seat at the table? How can I ensure that they are participating in a way where they are referring individuals into our program, which is great, and we want to continue to support those communities in that way. Then they're also providing such needed services that really, as I said at the top of the conversation right now, are at risk of going away. And as someone, and I could have mentioned this earlier, but I kind of say I grew up in the Boys and Girls Club. As I had parents who just weren't able to pick me up on time, or I had to have this subsidized care. And so as someone who was involved in the nonprofit space from a very young age, I know the crucial services that they're providing. And so it's always been, again, part of that like chip on my shoulder about I want to be able to give back to them in some way. And so this program was a vehicle to be able to do that.
Okay, awesome. Well, that's great. So you guys have now been in California for multiple years now. Are you able to share like any of your partnerships,
Sure.
where in the state you are? Tell us about that.
Yeah, so right now I'm really excited to be able to say, so Pear Team is the largest ECM provider in the state of California. And so right now from our plan partnerships, we're partnered with larger plans like LA Care, IEHP, HealthNet, and then you have some of your more local plans in Alameda County. We have AAH as well. And then there's a few others too, but it's really crucial that we have the relationships with these plans so that we are able to continue to serve the communities that we want to be able to touch, right? And so even within these communities, I mean, you have larger organizations like Catholic Charities. And so we have upwards of 7 different partnerships in the state of California, and there's only 13, I believe, in the state. And so that's been really exciting and rewarding. Talk about an organization that is so mission focused, so intent in giving back to their communities, but also looking for ways to continue to serve their communities, to continue to provide the services that they need to provide. So whether it is navigation or whether it is food boxes or clothing, we've been partnering with them there. Yeah. So that's been really exciting in places like Fresno, Riverside, San Bernardino, Monterey. So we have a few of those partnerships. And then we partnered with larger partners like Mercy Housing. That's also an organization that's pretty well known. We're actually expanding that partnership today. They're launching in our Pathways program. And so it's been really rewarding because no matter if I'm talking to the executive director at the nonprofit or I'm talking to the case managers, it really is the same understanding of the services that we want to be able to provide to their clients, and then in turn how they want to support their clients, because they know that they can only reach so far with the resources that they have. And so they see Pear Team as an extension of the clinical services that they're not able to provide, and vice versa. We really see the social care services as really invaluable for the individuals that we serve.
Very cool. Well, I didn't realize quite how large you guys were. So thanks for sharing the breadth of your organization. You mentioned AH. For those of you that aren't familiar, it's Alameda Alliance for Health there in Alameda County, as you referenced. So those are some great plans. You guys are throughout the state. This is really cool. So I know for many of the folks listening, they may have heard of Pear Team, maybe not. Is just your website the best, like pearteam.com? I don't even know if that's the website. Forgive me. I've been there. But
It is. And it actually just recently got a facelift. So the design is beautiful. And now, but yeah, pearteam.com. And then we have, of course, different sections of our website for different audiences. I think our LinkedIn does a really good job at expressing who we are. I always really admire organizations, specifically Pear Team has done a really good job of not making the community care hub or the Pear Impact Network this side project. It really is in the DNA of who we are, and that has been really lovely to see. And I think that you can tell that in our presence on social media and our website as well.
All right, awesome. So it sounds like you guys have a good presence. How about yourself? Are you active? Are you posting if people want to kind of see what you're up to?
Oh yeah. I'm always telling my team, because they go a lot in person to these nonprofits to visit them, to do in-person trainings, et cetera. And I'm always like, send me pictures, because I really do. I think although these organizations likely they have more of a presence on Facebook than they do LinkedIn, and so we cross-post there. But certainly it's my goal to also get their name out there, to showcase the great work that they're doing too. And so whether it is supporting these organizations with letters of support to their grantors or being able to continue to share what they're doing, it's been really lovely to continue to build these partnerships. And I love that they're beneficial on both sides. That is really the sauce.
Yeah, absolutely. Cool, Megan. Well, this has been a good wealth of information. This episode should be coming out about 24 hours um, after we interview. So, folks, if you happen to listen and happen to be at the California Association of Health Plan Conference, I believe some pair team leaders will be there. So you can let them know you heard the podcast. But if folks don't connect there, what's the best way to reach out? Just go on your website, contact us button, or what's the best way?
Absolutely. Or my email's open, megan@pairteam.com. I really feel lucky that I got the one and only Megan. So MEGA and pairteam.com. That's when you know you've made it.
Yes, absolutely. I know that feeling. Cool. Well, Megan, I really appreciate you joining, talking about tomatoes. And potential future salsas and hot sauce. I hope your boys like spicy, by the way. I'm not sure if you like spicy, but I'm a big
They'll learn.
And just your story too. It's a really cool story. And like I mentioned earlier, it really seems like this is a good fit for you to help build. I know you like to build things, right?
Yeah.
And congrats on the growth too, Megan. So again, thank you so much for joining today.
No problem. Thank you for having me.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.